Okay, so we're ready to get started now, right?
Mm-hmm.
Okay, so thank you everyone for again joining us today. Um, what we're going to talk about today are these four areas. We're just going to briefly go through the 10 guidelines for culturally competent nursing care that can be extended to anyone who is working with patients, families, individuals in the communities. We have Gigi Sears here today to talk about the work that she and her organization have done to really promote cultural competent care. Talk about collaborative tools and skills, specifically twosies and pop-ups that Kristen and June are going to share with us. How to continue to build a cultural competent network across the state of Kansas. So identifying and sharing resources through a resource list and making sure that people who are in the network and want to connect to the network know where to go for support with challenges. And then looking at, as we develop this network, are there opportunities for regional network development across the state? And if so, strategize to expand those networks. We've talked about cultural competency in the various sessions that we've already had, and there isn't a universal definition of cultural competency. The one that we have used for the center is the process in which the health provider continuously strives to achieve the ability to work effectively within a cultural context of a client, individual, family, or community. The one thing I want to stress is that there is not an endpoint. This is a continuous process. And there's been a lot of ongoing discussions about what's the best term to use for promoting cultural care or the integration of cultural norms, values into the care that's provided to individuals, families, and communities. So it might be cultural congruence, cultural competence, cultural proficiency. And I think that what we're really striving for is that we're providing high quality, person-centered care. And so in 2014, a group of expert nurses from several national nursing organizations and international nursing organizations revised some standards for culturally competent nursing care, which again can be extended to anyone who touches the lives of individuals and families within or outside of the healthcare system. And these guidelines really center around the individual care that's provided, again, so person to person, provider to patient or individual, and then guidelines that extend to how we are promoting cultural competency at an organization or systems level. So it includes the knowledge of cultures, perspectives, traditions, values, among culturally diverse individuals, families, communities, and populations, that we are critically reflective and reflexive in the care that we provide, that we are aware of our biases, our own cultural norms and values, and the biases that we have, how we can start to remove those biases. Cross-cultural communication, so making sure that we're ensuring our communication is culturally appropriate, linguistically appropriate, so making sure that we have interpreters. And this all culminates in providing culturally competent care. Today, Gigi's going to talk about the role that organizations have in the provision of culturally competent care and how organizations can work towards really being centers that champion cultural competency. Along those lines, we also want to make sure that we are patient advocates and we're empowering our patients by evaluating and introducing policies towards that end of health equity and achieving social justice. that we're also working towards multicultural workforces so that the healthcare workforce really mirrors the populations in our community, that we have leaders who are advocating for cultural competency in the work that they do, and that the practice that we engage in is based on evidence and research that supports the values, the norms of diverse populations, and is inclusive of those populations toward and research so that we can achieve, again, high quality care and outcomes. So with that, I would like to introduce Gigi Sears, and Gigi will tell a little bit about her role at KU and then the work that her organization has done. So thank you again, Gigi, for joining us today.
Thank you, Jill. I appreciate it. This is one of my favorite topics to talk about, and it's an honor to share the work that we've been doing. I can certainly say we don't have all the answers. We've been trying to make some small steps that are making a difference for our patients and families and staff. So I have a couple of programs that I'd like to talk about, just things that we've done. And the first one is one that I didn't expect it to be as successful as it has been. But some time ago, our health system created a program that we call the HERO program. And HERO is an acronym for hospital employees reaching out. And so any health system worker can create a community-based HERO event where they mobilize some volunteers, go into the community, do some good work. And since I'm in professional engagement, I started coming up with some opportunities for large groups of employees, usually 50 to 75, it could be small as well, in very underserved areas. So we'll take a group of people and go work at a food pantry in the inner city. And when you see, when you have your employees who may be from the suburbs, finding out that people wait for 24 hours for an opportunity to get some fresh vegetables, that it's like this connection to the communities that we serve. We've been to places that it's like a food bank, but they distribute hygiene products. And again, we start to hear about there's people that don't have toilet paper, so they use dirty clothes. And, from where I live, that is not something that I experience. And so we've been trying to connect our employees to this community that we serve, and it has been phenomenally successful. In 2017, we had over 900 employees going out to do this work in the community. So that's been a really fun, engaging way for people to become aware of underserved populations. And the more you're exposed, the more you understand and at least can empathize with, that person that, say, can't change their incontinence pad. They use the same one for 24 hours and they end up in the ICU with urosepsis. If you understand what's the problem, you can help. I put on my bullet points that we did this culture conference recently, and it was a day-long conference that was totally focused on things we haven't historically talked a lot about. We had a religious panel. That was a phenomenal success. We had a woman that was represented a pagan faith, a woman that was a humanist, a woman that was a Muslim. We had a rabbi and a Mennonite reverend. And we were shocked at people wanted more of that kind of education. We did a poverty simulation. And again, people were just so surprised at the limited resources that people that are surrounding our health system are working with on a daily basis. So that was a day-long, really exciting conference, the first time we did it. Our health system participates in the Human Rights Campaign Healthcare Equality Index Survey, and that's probably familiar to many of you. This is an assessment of LGBTQ care and resources that you provide within your system. And although it's directed at that community, completing this survey every year has helped us look at different populations, because the template that's there for excellence in that area can be applied to many areas. So we've completed it for 4 or 5 years. And this is the first time that we achieved leader status, which, again, was a work in progress. Our other organizations participating in the Healthcare Equality Index survey that you all represent. Well, happy to share more information on that at any time. We are starting, I took a class on the university side. So we have a hospital side of our campus, and then we say there's the university side. There's training that's offered there called Safe Zone training, and it's affirming care, again, for LGBTQ community members. And it was such a good course that we're now training some trainers this month so we can offer that widely within our healthcare system, which is really important. We now have a transgender clinic that's part of our health system. So we want to make sure that people understand what is needed by the community and their perspective coming into our place. So my bullets include next steps, more education. Every time we do education, people say we just want more of this. I think everybody wants to do the right thing and they want to be that great provider, and sometimes you just have to hear it first to understand. Changing up my work group members for the Healthcare Equality Index survey this year to be members of the community and allies as opposed to drivers of different departments. So trying to get people that have a stake in the work to be doing that work. And then on my last bullet point is our EMR is Epic. We use Epic, and it does not support our transgender population very well. So we're hoping that in this year we will have an upgrade that specifically addresses their needs. So that's a little bit about where we were at in 2017 and where we're headed in 2018. More in different education. So that's a summary of our world.
Thank you, Gigi. I wanted to ask you if you could, and then I think we'll open it up for other questions, comments. But I wanted to see, could you talk about a little bit about how the hospital or the health system now has gotten to this point of embracing and seeking these opportunities to really make sure that this high quality individualized care is being provided and that it's inclusive. So maybe perhaps what prompted the organization to start on this path?
Wow, that was years in the making. So, you know, I think like a lot of places, we said we take great care of patients and we take great care of all patients, and did recognize, but just wanted to say every group needs great care. And over time, we've realized through mostly missteps that we don't know what great care is for this person is not great care for this person, and the opportunities for communication breakdowns or cultural missteps is so great. Just often find from complaints that we've inadvertently not respected someone's cultural background or that sort of thing. So it was years of having some of that, and then we started a diversity and inclusion work group, and it's still small. Fortunately, we get to participate in the university's diversity and inclusion cabinet, which is run by the EVC over at the university, and they are very good with their education and their initiatives. So we try to follow some of their leads and access training that they have. I can say a lot of the work we do has come out of missteps. That's the honest answer.
Well, and I think that naturally, I mean, we do something and we're not, and perhaps it wasn't the best way or the right way, and so it provides that opportunity to be purposeful about the care, you know, that we are changing,
right?
How to change that care.
I teach a course that we talk about, and rather than the golden rule, we talk about the platinum rule. and I don't know if everyone's familiar with it. I hadn't heard of it, although I do love platinum. The platinum rule is not treating everyone the way that I want to be treated. The platinum rule is treating people the way they want to be treated. And I think that has become ingrained within our system. Although we have to learn it. That's where the education comes in, and trying to provide those opportunities.
I'm not familiar with that. I love that.
So Jill, I would love to just again invite people, if you have questions, please, I muted everyone just so the recording has the best quality. So unmute yourself if you have a question or comment. Really curious about, what did you hear that you thought, oh, that's intriguing. I saw some chat stuff early on. Somebody was saying, oh, I like this idea of a hygiene product bank. But now's a chance to sort of either ask some questions to Gigi, or feel free to also, I know we like to be humble, but sort of this is a chance to brag about something that you think is really great that fits under this guideline of culturally competent organizations. So let's just take about 5 or 10 minutes for people to share some of what you heard that you liked and will want to try, or what you're already doing as well. This can start off the new year with good ideas.
I'm reading.
If you have any trouble, again, this is not a pressure thing. If you have any trouble with your mute button, you can just go like this, and Jill or I could help unmute you. Otherwise, it's on the bottom left. There should be a microphone. You just click it, and you'll be unmuted.
And Deborah Fisher has a great question there in the chat.
Hang on, let's get to Deborah after Shirley was going to say something. Go ahead, Shirley.
Well, I was going to respond to Deborah's comment and question in the chat, actually. And I like, Gigi, what you said about bringing in LGBT people to talk about their experiences instead of experts who might not be LGBTQ+. So that is, I think, a really great way to start that conversation in any kind of agency. And then having folks who identify as LGBTQ+ on various advisory councils or patient representative councils is another way to start that conversation.
Thank you. I totally agree with you. We offered a session last year with a psychologist who specializes in gender affirming care, and she brought in a panel of members of the transgender community, and hearing their perspective, just hearing that each one of them said we would do anything to stay out of the healthcare system, because when we enter the healthcare system, we feel that we become the oddity that people are looking at. And hearing that perspective, that somebody will do anything to stay out of our world, is very sobering. So I agree with you. Having people carry that message is really the right way to do it. And in the summer months, there is a transgender conference offered at University of Missouri, Kansas City. If somebody's really wanting to learn more about that particular population and the way to provide affirming care, highly recommend. It's a very low cost, high impact conference.
I think, Kristen, you're muted.
Okay. So I'm big in the mute so we can try to get the best recording quality. Gigi, thank you so much. Let's all give her a big, I don't know, this kind of applause.
Cyber hug for everyone.
Cyber hugs for everyone. And I think I'll shift back to the slide deck now. So fasten your seatbelts. Hopefully it won't be too bumpy. And I'm also really glad that Shirley is having lots of exciting questions. Oh, yes, I do. Because that's what this is about. It's sort of to prompt things that you decide, oh, this is, great. I'll just talk about it at my lunchtime things, or, oh, I want to do a little follow-up individually, or ask if there's a small group that wants to talk about GLBTQ+ resources, etc. But let's move on. And again, the slide deck will be yours to have and share too. Open this up. So part of what Gigi was just talking about was sort of the stages of how her organization started to moved from a crawling and just thinking about this with some really missteps. And again, that's sometimes how we learn, to maybe being able to have a small work group, walking and running. And I did this slide before I actually had a chance to hear Gigi, but it doesn't really matter where you are. It just matters that you know where you are and what's the next opportunity. And so I think I put this down yesterday, like a crawl might be that there's stuff happening, but there's no small group. There's nobody formally identified with the responsibility. And the walk step would be getting a little more clear about who's going to take the lead, again, even if it's small, and how does that small group start to do some things that are going to generate interest and seem relevant. A run organization might be a little bit more that there's both formal and informal people that are stepping in, and they're coming from diverse groups. So as I think Shirley was saying, it's not the experts that know about, but it's people whose lived experience is things, and that there's lots of pathways for people to contribute and provide leadership and learn and teach. So we're curious, again, if you have ideas, and maybe I'll go back to, so we can see each other, that's a lot more fun than these slides, but ways that you have, like where your organization is now and how you're thinking about moving it forward. Are there some things that you could do in your clinic or in your institution that would help you say, we're in crawl stage, ready to move to this? So I'm going to exit out so we can see faces.
One thing that I've
People
been
have-
looking at is the importance of what I call framing, like a meta frame, right at the beginning of your session, any session you have with students or others, employees in your organization, and trying to, and maybe that's something that we could actually work on here, is just like, how do you talk about, like, every patient is precious, deserving of complete respect and acceptance and attention, and say, you may have your own religious beliefs or other beliefs about something that you think's right or wrong, but that has nothing to do with totally caring about and attending to and respecting, a patient, no matter what they come at you with. And I think the more, maybe that's just not quite the right, maybe you could all come up with a better kind of frame, but just saying those kinds of things, and that that are going to really get people thinking differently about this, that they're not thinking about patient care based on their own belief systems, but on this, this larger thing of really caring for people. I don't know, any of you had that experience or tried something like that you felt like really shifted people?
I'm going to give one example that I use with new employees. I ask them what diversity means to them, and they kind of come up with race, religion, orientation, some of those bigger things. And then I talk about the kind of diversity that I've been seeing here, and our diversity just widens all the time. And I use one example of two patients that came in that said they were vampires. And they had changed their names, they'd filed their teeth. I don't know who does that, but they had it done. And each one independently said they self-reported that they drank blood. And so when I'm speaking with nurses, I ask them, if somebody laughs the first time they say that, will they ever say anything more to us? And they won't. And then asking the question, do you have more questions that you want them to answer? And everyone goes, yeah, because most of us with our background, my background, I don't know what that means. So I try to use some of those maybe small populations, but really show the impact if you're a prisoner, if you're, a witch, if you're a bariatric patient, we talk through that experience and what that looks like and feels like as best we can. So I don't know if you guys have vampires at your organization, but we continually see different populations and have to be prepared and thinking about what it feels like to be them.
And I don't know if this maybe tags on to your comments well, Gigi, but I think sometimes what how we interact with patients may be okay when we hear something like, I wouldn't expect to go into a room and someone tell me that he or she's practicing vampire. But then how we convey that to our colleagues can impact the care that's provided, because what we say behind the scenes can be said in certain ways that then that influences the actions of that next care provider. And so I think that the information that we provide to each other and how we provide it is really important as well. And that we don't come out of the room and say, you're not going to believe this, but we've got a vampire. I mean, that says a lot. That kind of messaging, I think, conveys a lot about what I think about this person. I don't know where I'm going with that, but anyway, I just wanted to interject. Shirley?
Yeah, I think one of the challenges that I have had is that I try to do that as well as much as my ability, and then I'm perceived as being holier than thou. And so trying to balance with being responsive appropriately to diversity, but also understanding that we have diverse healthcare providers and peers that we work with too, and trying to figure out how do we meet everybody on their own terms. And it's very taxing to try to be able to do that. And I just wanted to throw that out there.
Mm-hmm.
I don't want to be holier than thou, but at the same time, I think I have an important piece to play in making sure that we do our best to be responsive to patients in an appropriate way.
Right. Yeah, absolutely.
So as I'm going to shift to slides, but please keep sharing your thoughts in the chat box. And again, June or Jill will let me know if there's something we really want to.
Right. So, Kathy, Abby, Christy, Becky, those of you who, if you could just in the chat, just share a little bit with us, I think it would be great, whether you have any questions or experience, because we really need to hear from everyone. This is hard stuff, and we need everyone's questions and perspectives to really learn.
So I'm not going to spend a lot of time on this slide, but here are just some other ideas and tips that have been tried. We've heard a number from Gigi today. We've heard some great ones from Deborah and Shirley. And sometimes after people get the initial piece of information or the question about what is diversity, it helps to have some follow-up pieces. So things like having brown bag lunches or conversation starters at the beginning of a meeting, or ways to get feedback or data that you can start sharing. Even those affirmation posters, like the one that Gigi shared at the beginning, the information piece around transgender, as a way to remind and reinforce what's the environment that you want to create, and who are the patients that you want to be. How are you sensitive to who's showing up, coming through your doors? This next month, as we again sort of grow as a community and settle into getting to know each other and the things we care about, one of the things we want to really focus on is twosies and pop-ups. And so twosies is a simple thing. It basically means that I send a little email out to somebody like Shirley and say, hey, can we have a virtual chat? And we can do it on the phone, or we would advocate that you use some video conferencing like this. We could make this platform available, or you could use Skype or Google, because it allows you to connect, and you might follow up because you saw somebody post something in the chat box that you're curious about, or they're calling in from a part of the state that you're interested in. But a twosie is a way to follow up with somebody and just get to know them and what they're doing and what they care about. A pop-up is, and Laura, who's on the call, you can wave, Laura. I can't see you because my screen is covering you up, but you can wave so everyone can see fabulous Laura. She's going to send out some meeting schedulers so that everyone who indicated to us when they filled out the network mapping software that they were interested in one of those 5 things, either assessment related to cultural competence or advocacy and empowerment. If you said you wanted to talk with others about that, she's going to send up a little, send out a poll, and we're going to try to find a half hour to an hour at the most, but half hour probably, for us to just do a little learning pop-up. And that means we're going to get online quick, we're going to meet each other, we're going to hear, hey, what's up with you around this topic? What are you working on? What do you need, if anything, from others? What might we do together? And it's a way for us to connect around people who have a shared interest. So Laura's going to do the scheduling. I'll be on the platform just to help the conversation go, but it's a way for us to connect in smaller groups around things that we care about. So that's kind of the focus. And one of the tools that we have for doing that is some network maps. And I'm going to let June talk about these maps. We started them in December and they've already changed and grown. So June, do you want to talk about these?
Right. So I don't know if you remember the last map, but this map is certainly much more connected than the first map we did, as people are taking the survey and showing us what's happening. And I think this is a good thing to think about in your own work, in your workplace or whatever, where you're kind of like starting out as the hub, somebody that really cares about this. And part of what you need to do is begin to identify others that also care about this issue and can both provide support to you, because it's definitely, this is really leading edge and pretty difficult work. And you need to build your own support in your own network in your workplace. So I think what we're doing, this idea, and some people just put maps up on the wall using Post-it notes and think about who else might be interested in this topic. And one easy way to start is to reach out to a person and have a Tuesday with them. So here's the map, and each color stands for the topic that that person said they were interested in. But I'm going to really take us to the next map, which is really where I took Jill out, because right now she's our leader and she's the hub. But Kristen, can you move the slide, or Jill? Yeah, great. And so this one shows a little bit more some of the groupings. It's easier to see people's names. We also sent this map to you, I believe, in an email. If we haven't, we will be doing that. So you can actually, you may be having a hard time reading some of these words on the screen, but you can actually print this out and take a look at it. And what I'd like you to do is, if you can make this as big as possible on your screen right now, and then look at the topic that you picked. You can find yourself somewhere on this map. Oops. Okay. Whoops. We're popping all around here. There we go. There we go. Don't touch it. Don't touch it. Okay. So can everybody find their name on this map somewhere? If you can't, I can see pretty well. You could just put in the chat or whatever. Like I'm trying to see, where's Sue Ann? Can anybody see Sue Ann? Maybe Sue Ann, you haven't taken. Have you taken? Oh, get yourself off mute there. Have you taken the survey?
Oh, I see. I see. No.
Where is she?
Yes. Yes, I did.
Oh,
Okay.
you took it. Okay, so you're here some. Oh, there you are.
Oh, there, I finally found me.
But you didn't pick a topic. Yeah,
yes.
you didn't on that part, picking a topic. So, but you can tell us which one of these you are most interested in right now.
And see, this is a good thing, because now I listen to Gigi. Now I know I want advocacy.
Oh, okay, great. Okay, so let's.
And I'm going to make Shirley work.
Advocacy, I mean, really, that was just an incredible story, huh? So we'll make sure that we put you green on the next map. And so, but what I'd like you to do is look for, so Sue Ann, you're interested in advocacy. Now, if you can see on this map, there's Angie, there's Diana, there's Shelley, Angie's on here. No, and here's another Angie. Angie Stegman are all interested in advocacy as well. And if you go up to you see it in the upper right-hand corner of this slide, if you click that, and you will be getting the slides right after this call. But if you click on that, it will take you to a spreadsheet that has everybody's names in it and their interest areas. And what, I think that's what Kristen's doing right now, trying to go to that, huh? And so then you can find their email, and you can just send out an email. And I know this may seem a little bit, scary at first, but just send them an email. I saw that you were interested in the same topic. Could we just chat for a half an hour, some lunchtime or whatever? So this list right here has the emails, and it says what interests people have. And so you can just use this very simply to find one other person, because this is the most basic network building strategy you can do, is to find a twosie, find somebody else and get support, thinking, and ideas from them. So Kristen, if you can go back now to the map. So can somebody else now Deborah, Shirley, Becky, Christy, Kathy, did you all take the survey? Maybe if any of you haven't, I think Jill can send you that link again, and you can take it. So you'll be on the map, and we'll have your connections, like who do you know in this group, and you'll be able to see other people who have the same interest. In the meantime, you can actually just look on that list and try to find something. So this is a real challenge. I know you're all busy, but this is like an investment in learning network building skills. And the only way we're going to get to a place where, people are accepted for who they are in the health system is by each of us learning how to reach out and build these networks of people who care about this issue. Okay, so Deborah says she is also interested in communication. So Deborah, you might look for someone on that list who's interested in education, and just shoot them an email and try to set up a call. So we really want to hear from you in the next call about your successes and having a twosie with somebody. And part of the thing is, as Kristen's doing these pop-ups, you'll have a chance to meet some of these people. So they won't be strangers, it won't be cold calls, but you can follow up after those pop-up sessions, with a call to find out more details or get some more support for a particular challenge that you have. And then, what I'm seeing next month after our next call is that we can branch out. So that Deborah, if you wanted a session just talking about some of the things that you faced, you can just put out a call for that. We can get it might be just 3 people, or it might be 5 people, just to talk about particular issues that you're facing right now. They don't have to be these larger ones. So whenever you're in a new area like this, it's really important that we kind of bootstrap each other up in our understanding and learning about this. I've already been so touched by the stories that have been shared today, and it's really both raised my consciousness and interest in the topics. Okay, so I think, Kristen, you talked about pop-ups.
Yeah, I mentioned, can you hear me okay, June? Can you hear me?
Yes.
Oh, sorry. Sorry, everyone. This is like the first time I've ever had the deck open on my computer fully, and it means I can't see the chat. So I'm feeling a little bit like I don't want to jump in inappropriately. But okay, so you can hear me, and I did mention something about the chat, and I heard it sounds like people are starting to say, I want to be in this group, or I want to be in 2 groups. That's great. The most important thing is either put yourself in the chat and say, Laura, when you send out the doodle poll, which is just a software that helps people schedule meetings easily, just tell Laura that you want to be included. And that's not a commitment. It's just a way to be on that first list when we try to have a little get together. And Laura's going to do her best to try to schedule those between now and the next time we gather as a group. So let her know.
Laura, I really suggest that Laura, you send it out to everybody, and then they can decide whether or not they want to go to any particular one. I don't think we need to just send it out to the people that said that was their interest, because we have a list of 48 or so people, and I just think letting everyone have a chance, if they're that interested, they can come to them all.
Awesome. That's a good idea. And the beauty of these pop-ups is to try to get small little conversations going too. So we'll do both and at the beginning, but feel free to join one that we set up. And then I'm confident that by the end, it's a little bit like Shirley said, oh, I have so many ideas. You'll just all start doing this naturally because you're curious about each other. The next slide is about resources, and what, again, Laura and I will do is go back to some of the incredible things that were already shared and put them in the resource list. Let me show you. I'm going to show my screen. So you'll all be getting the slide deck and the materials that were shared today, meaning the slides, and pretty soon, probably within 48 hours, we'll have the recording edited. So every time there's a session, you're going to go in and you'll see the slides and you'll see some files that are recordings, and those we encourage you to use and share. You'll also see down here where it said network, KCCA networking. That's the list that June was referring to. So we've taken a peek at that. But then one other thing that we started, and I will go and pull all the great stuff that was shared today, are what are other resources that people think are great. So some of these I pulled off of the KCCCA website, but I want to go back in. Gigi named a number of online training tools, and I'll put Gigi's name down here next to the online learning. And we want to kind of it's going to be a peer-based set of resources, so that at the end we have great resources, as well as I could quick reach out to Gigi if I'm like, tell me about this again, and how did you use it, and why was it valuable? So that's all going to be, you'll be invited at the end of this call to a public folder that's really called this maybe I'll change the title to KCCA and network building. So sorry, I'm having a little glitch. So some resources that we'll be building together are harvesting from your big brains. One more slide, and then we'll invite people to share before we go. Please, before the next conversation, reach out to somebody, and that's the Tuesday that we talked about. Just have one conversation, put it on your calendar.
Are you going to share this slide?
Oh, I thought I was.
No.
Wow, I am. Oh, sorry about that. I'm reading it so you can tell that I'm. Can you see it now?
And let's give big hurrah to Kristen for being bold, and because I usually move the slides, but she's doing it today and doing a great job.
Yeah, you just got to trust your people, right? I know that you all are putting good things in the chat, but okay. So we hope you'll reach out to somebody. You'll join a pop-up if you can. If you can't, don't worry. We're going to keep doing them, but throughout this time, as people generate things they want to talk to others about. You could still invite somebody new to this session. This was a great number today, but if there's somebody that you think, oh man, they should be here, they would love it. You can add a resource, or I'll do the ones for today, but feel free once you get the link to go in there and add things. Put your name so we know that who to follow up with if we want to know why it's so great. And then for those of you, oh, I wish I had a magic wand because I would just give everyone a webcam. I really miss not being able to see Becky, or not being able to see Susanna, or people who weren't able to be on webcam, because it just helps me put a face, if you'll put a face to a name. So we have 4 minutes left, and I just want to allow people to unmute. We're curious if there are things people want to say in closing, questions, or takeaways that you've had from today's call.
I wanted to just mention 2 good resources, and they're in the resource list. I put them in there. There are some resources that are free regarding implicit bias. So through Harvard University, there's an implicit bias test, and individuals can go in and do this test to evaluate if we have implicit biases towards different social groups. So that would be a great resource for students to use or to have the students do, just so that they can see if they have some implicit bias. And then the Kirwan Institute for the Study of Race and Equity is a great resource. They do a lot of research regarding social and health equity, and they have partnered with MTV on it's a 7-day challenge about addressing our implicit biases towards different social groups, particularly racial groups, ethnic groups, and then LGBTQ. So that's another free resource that we can use, that we can share with employees and students. It's free, and it's a 7-day challenge. So each day you sign up, they give you little tips or self-assessments that you can do to address bias. So I think some fun things that we can use again for that really important critical reflective piece.
And Gigi is looking for a speaker on unconscious bias. So if you have any recommendations,
okay,
just make sure that put them in the resource list. Okay, Deborah had one.
I'm getting those resources to type in really quickly.
All right, amazing people. We're close to the hour, so no pressure, but feel free to take yourself off mute, or maybe I'll try to unmute people and you can at least say goodbye. Or
what you got out of these sessions. What would you like to follow up and talk more about? So if you could just all real quickly let us know.
I was just going to make a bold offer. Anyone that's in our area that would want to participate in our outreach events in the community, just to see what we do and kind of observe that connection that people make, those connecting the dots with poverty or food scarcity or whatever, I'd love to have you. Let me know.
Thanks. Thank you. Well, thanks.
Becky, anything? Suzanne, anything that you want to share?
I don't have anything right now.
No, well, I so appreciate you being on and multitasking. Go ahead.
Yes, thank you. And be aware that some of us are actually on mobile devices.